follicle. Those follicles are lined with cells, like every other part of the body is lined with cells. So you have a pore that the rabbit's going to go into. You have a follicle that the rabbit lives in. So far, so good. I'm using, you got to say yes or no, AJ, because I can't see anybody. Okay. Now, that follicle is lined with cells. And when those cells divide very rapidly, I'll tell you why that happens in a minute, and they secrete proteins as they're dividing, plugs can form. This is the beginning of an acne pimple or a comedone. You have cells that line the follicle. They divide rapidly due to dysfunctions, which we'll talk about in a second. And as they're dividing, they're secreting proteins. These proteins and these cells clog the pore. That's the beginning. There's also a little oil gland inside the rabbit hole, inside the follicle. That oil gland pumps out skin oils, which is called sebum. So if you have rapid division of cells inside the follicle, you get a plug. Then you get secretion of sebum. And if that sebum is being secreted in great abundance, now you've got a plug with a bunch of oil. You got a problem now. There are bacteria that live on the skin traditionally and live in the rabbit hole. When those bacteria become trapped inside that plug and the oil is being secreted, now these bacteria have an opportunity to proliferate because they love oil. They eat oil. The oil feeds the bacteria, and these bacteria don't like the light, and they don't like oxygen. We call them anaerobic bacteria. And now you've got a plug, a bunch of oil, and a dark, oxygen-free place for these bacteria to proliferate. This is how a pimple develops. 3 factors. Hyperproliferation of skin cells, they're called keratinocytes, by the way. In combination with deposition of protein, you get a plug. Hypersecretion of sebum from the oil gland that lives in the rabbit hole, lives in the follicle. Now you've got an oily plug. Bacteria that get trapped inside that plug now have an opportunity to have basically an all-you-could-eat buffet with no oxygen and nothing in the dark, nobody bothering them. And they go to town, and that's where you get your typical pimple. This is important because you can't deal with your pimple unless you address the 3 factors. If you go to the doctor, the dermatologist, what are you going to get? You're going to get an antibiotic. All that's going to do is kill the bacteria. That's not going to do anything for the problem. The bacteria are not the problem. They're the end result of the problem. This is why bacterial strategies are hardly ever work, or antibacterial strategies hardly ever work. Okay, you got to nod your head because I can't see if this is making sense.
I'm hearing you. I'm with you.
Okay, so there's 3 factors for dealing with acne. Number 1, you got to control the growth of skin cells. Let's talk about that. What causes skin cells to hyperproliferate, to grow fast, to grow out of control? Okay, and this is really interesting because the default state for a cell is growth. It actually takes work and nutritional resources to put the brakes on growth. The growth is the default state. That happens automatically, breaking the growth, putting the brakes on the growth, suppressing, slowing down, inhibiting hyperproliferation. That takes nutrition. That takes work. The most important nutrient for stabilizing, normalizing, slowing down hyperproliferation of cells, all cells, not just skin cells, all cells, is vitamin A. And this is why vitamin A is the treatment of choice, the nutritional treatment of choice for dealing with acne. Not just vitamin A in terms of the nutrient, but also prescription vitamin A applied topically. Prescription vitamin A, it goes by the name retinoic acid or retinol. Retinol doesn't require prescription. Retinoic acid does. They're very similar in their effects. This is why people put vitamin A on their skin for acne. That's why they put Retin-A on their skin for acne. This is why people put retinol on their skin for acne, because it slows down, stabilizes, normalizes the hyperproliferation of those skin cells inside the follicle. That's step number 1. If you can eliminate step number 1, you can go a long way towards improving acne. And this is why Retin-A is the treatment of choice for dealing with acne. And vitamin A taken orally is the supplement of choice, the nutrient of choice for dealing with acne. Every acne patient, true acne, not faux acne, should be on vitamin A supplements or topical vitamin A, retinol and retinoic acid. Everybody who's dealing with comedonal T-zone acne. That's number 1. Number 2, there are hormonal reasons for rapid division of skin cells, and there are hormonal reasons for hypersecretion of sebum. Remember, that's the second factor. The main two hormones, and they're related, that are involved in hyperproliferation of skin cells and hypersecretion of sebum is the male hormone testosterone in conjunction with the hormone insulin. And they overlap. They work together. So to control hyperproliferation and to control sebum, you're going to want to slow down secretion of sebum by going ketogenic, going low carb, using blood sugar support nutrients. In fact, there are some dermatologists, and when I was in pharmacy school as well, who call acne skin diabetes. And in pharmacy school, back in the old days when I was in pharmacy school, we used to use anti-diabetic medicine to treat acne, because anti-diabetic medicine slows down insulin secretion, makes the body more responsive to sugar. And that will have an anti-sebum effect, and that will have an a slowing down effect on the proliferation of skin cells. So the second thing you want to do is you want to treat yourself like a diabetic and use nutrients that support blood sugar. When I say treat yourself like diabetic, I mean going ketogenic, going low calorie, eliminating sugar, refined sugar, starches, etc., which we should all be doing anyway. And it's interesting because teenagers oftentimes are eating crazy amounts of these kinds of foods. Just that alone will slow down sebum secretion. And by the way, if you just have oily skin, that's one of the signs of poor blood sugar control, even if you don't have acne. So oily skin should be also treated as a blood sugar issue and a stress hormone issue. Those two overlap as well. So how do you slow down sebum secretion? Well, number one, by going low carb and treat yourself like a diabetic. Use your sweeties and ultimate niacin and ultimate selenium and MSM sulfur, all the diabetic things. And then work with your male hormone. There's a couple things you could do for that. Just by working on the blood sugar, you're going to have a beneficial effect on male hormone. But there's also a mineral that's very important for keeping testosterone from being overactive. And that's the mineral zinc. And you'll also see zinc, by the way. Zinc is the mineral of choice for treating acne. Just like vitamin A is the vitamin of choice for treating acne, zinc is the mineral of choice for treating acne. You'll also notice that zinc is used to treat male prostate issues, BPH and such. And the reason that is because the same hormone system that's involved with acne is also involved with BPH and prostate issues. And this is a little clue for you. If you're a man and you're dealing with acne when you're young, you're also at risk for prostate issues as you get older. Mm. So zinc is the mineral of choice, like vitamin A is the vitamin of choice. Now, there are also other nutrients that you can use for helping stabilize testosterone, in addition to the blood sugar control nutrients, and in addition to using zinc. There are also strategies that involve essential fatty acids, particularly the ones you get in the Ultimate EFA, an essential fatty acid called GLA, omega-3 essential fatty acids. Both you'll find in your Ultimate EFAs, and your androgenic acne patients should also be in the Ultimate EFAs. So basically, we're looking at the healthy blood sugar pack here with a few other extra nutrients. You notice we didn't say anything about skin here. We're talking about hormones. We're talking about chemistry. We're talking about blood sugar. We're talking about the internal metabolic milieu. Most doctors, dermatologists, skincare professionals will try to treat this thing topically. And this is why we fail for the most part. There's things you can do topically, but you're not going to get rid of the acne permanently by treating just topically. So you got to go with a blood sugar control, and you have to go with stabilizing the growth of skin cells. Vitamin A's partner in crime, if you will, is vitamin D. Vitamin A and D work together. So using vitamin D is supplementally, or getting out in the sun, which is the best way to get your vitamin D, will have a beneficial effect for your acne patient. And some accessory nutrients for helping stabilize testosterone, male hormone, as well as sebum, are selenium, the ultimate selenium, which you'll get in your healthy blood sugar pack. The aforementioned essential fatty acids, ultimate EFAs, and then chromium, vanadium, which are your sweeties, which will also help you with blood sugar. Topically, topical vitamin A, whether it's retinol or retinoic acid, will help. as well as something called alpha hydroxy acids or beta hydroxy acids. My favorite is something called salicylic acid used topically. Now, these will only help improve the appearance of the skin topically and accelerate the healing of pimples, but they won't change the metabolic issues, which are based in male hormone and blood sugar and nutritional deficiencies. Now, all of this is for true acne, androgenic acne. The second type of acne, you can call pseudo acne, gets treated like acne, but it's not acne. This is rashes and bumps that appear on the side of the skin or the side of the face, on the cheek area, sometimes on the jawline area, sometimes even on the side of the nose area. Usually, if they're rashy, red, in biochemistry, we say they're macular, referring to flat rashes, rather than papular, referring to pimples. This is not acne, and it should not be treated as such. And if you do, you will fail. And like I say, you'll end up with a big red mess, or your patient will end up with a big red mess on their face. This is a condition that involves the immune system, especially via digestive toxicity and leaky gut. This is a food issue and a digestive issue, and you need to treat it that way. That is, food diary, eliminate problem foods, use nutritional support for the digestive system, which of course are the nightly essence, the ultimate enzymes, the I-26, Dr. Aria's liver cleanse, the ultimate microbiome. You treat this kind of acne as a digestive issue, not a T-zone or acne issue. It's an immune condition. If you try to treat it with retin-A and benzoyl peroxide and alpha hydroxy acids and chromium, vanadium, and sweeties, you're not going to get good results. But if you treat it with eliminating problem foods and digestive support, almost immediately you'll start to notice benefits. And within, depending on how severe it is, within 4 to 8 to 12 weeks, it can be completely gone, never to appear again. And the reason this is important is because the same immune and inflammatory condition that's causing the breakouts is also leading to inflammatory conditions that could be worse down the road, including inflammatory conditions that involve the lymph, inflammatory conditions that involve other aspects of the immune system, overall immune inflammatory conditions that can lead to other health challenges. So this is much more than a cosmetic issue, this kind of faux acne or pseudo acne that appears on the side of the face versus the T-zone. Now, there's also sometimes people have both, in which case you got to do both. You got to address it androgenically with the male hormones, as we just explained, in addition to foods. The most likely foods, and I say the most likely foods, but it could be anything, but the most likely ones are going to be beans of all kinds. And that includes that includes nuts, peanuts, I should say. Peanuts or legumes, soybeans, pinto beans, kidney beans. Beans in general are a big, big problem for a lot of people. Flour and grains, eggs, eggs, dairy. Those are the big problems, but it can be anything. And that's why food diary is so important, as well as digestive support. Nobody should have acne. If you address true acne, comedogenic acne with nutritional supplementation, blood sugar stability, using diabetic strategies, it'll go away forever, never to appear again. If it's faux or pseudo acne, immune acne, inflammatory acne on the sides of the face, if you correct the digestive issues and you use digestive support supplements in addition to food elimination, it'll disappear forever, never to come back again. And by the way, if you eliminate foods and your skin clears up, you can have those foods once in a while once you're cleared up. You don't have to have zero tolerance, but you can't have it a lot. But you don't have to feel like I'll never be able to have beans again, because once you clear it up, you can have these foods once in a while. But while you're trying to clear up the condition, you want to go zero tolerance. Okay?
Ben, yeah, you know what, Ben? That was the easy question.
Okay.
So now, and I appreciate,
I can't see. Do other people? Do we have questions on that?
We have plenty of questions
on
that specific. I mean, we could kind of tie in what can we do for psoriasis, but I actually would like to. You
want to move on? We can do psoriasis later. Psoriasis, by the way, is very easy. Psoriasis is an autoimmune disease. An autoimmune disease is when part of the body looks distorted to the immune system. And then the immune system attacks that part of the body. If you have a distortion in the thyroid, the body will attack the thyroid. Or the immune system will attack the thyroid, thinking the thyroid is distorted and the enemy. You get Hashimoto's disease. If the pancreas, cells of the pancreas are distorted and the immune system attacks the pancreas, you get type 1 diabetes. If the myelin sheath on the nerves, on the neurons, appears distorted, the immune system will attack the myelin sheath, and you'll get multiple sclerosis. If the same thing happens with the adrenal glands, you'll get autoimmune disease of the adrenal glands. If it happens with the pigment cells, you'll get autoimmune disease of the pigment cells, vitiligo. If it happens with the skin cells, the keratinocytes that we talked about earlier, you get psoriasis. The point is, psoriasis, Hashimoto's disease, Graves' disease, type 1 diabetes, multiple sclerosis, Cushing's syndrome or Addison's disease, whatever it is, whatever your autoimmune disease is, they're all treated the same way. It doesn't matter that it's the thyroid. It doesn't matter that it's the skin cells. It doesn't matter that it's the pigment cells. It doesn't matter that it's the pancreas. It doesn't matter that it's the neurons. It doesn't matter what cell is being attacked from a healing perspective. This is so important because logically, if we have psoriasis, we go to a dermatologist. If we have a type 1 diabetes, if we have a pancreatic issue, we go to an endocrinologist. If we have a thyroid disease, we may go to an endocrinologist. If we have a nerve disease, we may go to a neurologist. It doesn't matter. It's all the same bodily, biochemical, metabolic breakdown. And whether it's on the skin or the nerves or the pancreas or the thyroid or anywhere else is irrelevant to healing. The question is what distorts the cells? Why does my thyroid look foreign, distorted, look like the enemy? Why does my pancreas look foreign, distorted, look like the enemy? Why do my skin cells? Why do my pigment cells? Why does my thyroid? Why does my part of the body look distorted? And the answer is always something that's getting into the bloodstream that is being deposited in the various parts of the body. So the question then becomes, how do things get into the bloodstream? Well, there's only two ways. Number one, if you inject things through your skin, it can get into the bloodstream. And guess what? People who inject things through their skin, whether it's illegal drugs or whether it's vaccines, can get autoimmune diseases because now they've injected things into the blood. But for the most part, the way toxicity gets into the blood is through a leaky gut, through the intestine. So for all autoimmune diseases, all of them, it doesn't matter where they're showing up. It matters that they're showing up. Get it? Not where. It matters that you're having them. It doesn't matter where you're having them. The issue is toxicity in the blood. How do you deal with toxicity in the blood? Well, if you're injecting things through the blood, stop injecting. But for the most part, it's food. So you do the whole digestive support workup. Number one, you do a food diary. Or if you want to do really want to do it right, fast for a day or two or three. You'll notice that your MS symptoms improve. You'll notice that your psoriatic plaques improve. You'll notice that your thyroid function improves. You'll notice that whatever your autoimmune symptoms are, when you stop the stream of toxicity that's entering into the bloodstream through a leaky gut, your symptoms will improve. Now, depending on how far down the rabbit hole you are, it may take longer, but for most people, it'll take within a few days to a week before you start to notice differences. Now, you have to eat eventually, obviously, but when you start to eat, you eat carefully. You keep a food diary. You chart everything you eat with your symptoms. Your symptoms, your autoimmune symptoms, and your digestive symptoms. So you notice every time I eat corn, every time I have oats, every time I have beans, every time I have milk, every time I have ice cream, I bloat, I have gas, I have discomfort, my plaques get worse, my pain gets worse, my inflammation gets worse. Whatever the markers are, you compare your foods, the foods you've taken in with your symptom markers. And then you start to eliminate foods. At the same time, you strengthen the digestive system. Number one, with nutrients that improve digestion, the ultimate enzymes are a must-have. The nightly essence, the ultimate microbiome, Dr. Aria's liver cleanse, the daily digest, which has now come out, I heard, is we have it back up. Anything for digestive support. And then you want to strengthen the intestinal lining. Remember, this is leaky gut. This is caused by leaks in the intestine. So strengthening the intestinal lining is also important. This is for all digestive health issues, which are really all the beginnings of all health challenges, but specifically for this psoriasis patient. So you strengthen the digestive lining, and that is using collagen support, your healthy bone and joint pack, your collagen peptides, collagen powder, the glucogel caps. Anything that builds collagen, that builds connective tissue, will help strengthen the intestinal lining. And then for skin issues, especially psoriasis, fats. The skin is a fatty organ. So fats are very important, particularly ultimate EFAs, especially omega-3s, and fish oil, or cod liver oil specifically. Vitamin A, retinoids that we talked about earlier, retinol, retinoic acid, and vitamin D. Vitamin D is so important for the psoriasis patient that even dermatologists, if you go to the dermatologist, they'll put you under a sun lamp so you can get vitamin D. But you don't need a sun lamp. You can just go out, lay out in the sun, as well as use vitamin D supplements. And you can also use vitamin D topically by either breaking open a capsule or at Truth Treatments, which is my skincare company, we have vitamin D, topical vitamin D that you can use. So vitamins A and D, omega fats, ultimate EFAs, especially omega-3s, and cod liver oil. The minerals zinc and selenium. By the way, dandruff is also treated this way. Dandruff is very similar. In fact, Head and Shoulders is zinc, and Selsun Blue is selenium. And these are all the same kind of health challenges. They're all dealt with the same way, topically as well as internally. And that's for all autoimmune diseases, not just for psoriasis. And it's really for all skin issues, acne and dandruff included, and anti-aging for preventing wrinkles and preventing fine lines. And then topically, for treating psoriasis, you do the same thing as topically treating acne. Remember, acne is a hyperproliferative condition, cells dividing really rapidly. Psoriasis is the same thing. In a way, psoriasis is very similar to acne. It's cells dividing really rapidly. You don't have the oils and the bacterial involvement, so you don't have the pimples, but you got that same hyperproliferation. This time it's appearing in plaques on the skin rather than in clogs inside the follicle. But it's the same thing, same kind of treatment. Vitamin A, vitamin D, essential fats, food elimination, keeping your blood sugar stable. What you're going to hear, and you're probably hearing this already if you've been listening, is we say the same thing over and over again. Digestive support, blood sugar support, stabilize insulin, use your fatty nutrients, eliminate problem foods. This is general good health strategies, no matter what your health challenges are. And even if you don't have health challenges, just to stay healthy and to live a good, long, strong, productive life. All right?
Pharmacist Ben, just again, it's just a course. Wait till I take all the transcripts, and you wait till you see what happens with all your transcripts. So anyway,
okay.
So we have let's try and deal with the biggest question that we have of the day. And I don't know if there's much we can do, but there's a woman concerned about a friend whose baby is in utero and has congenital diaphragmatic hernia.
Okay, so that is a birth defect that's occurring inside the womb. There's a couple things about that. First of all, there isn't much you can do with that aside from surgical procedures, which they do now. And there are some interesting fetal surgeries that can be done for that.
In utero, they're going to do the surgery.
In utero, yes, in utero. There are strategies that you can use in utero for addressing this kind of condition. They do all kinds of really cool surgical procedures, just so you know, these days.
So you're then saying that doctors have an important purpose.
Doctors do for surgical procedures, absolutely, for like emergency kinds of things. The treatment is really kind of an interesting in utero treatment. Fetoscopic occlusion, they call it, FETO, fetoscopic endoluminal tracheal occlusion is technically the name of the surgery. They call it FETO, FETO. And that is a really interesting procedure. And you're right, surgeons can do incredible things. And while we rip on physicians when it comes to treating chronic long-term degenerative diseases, that's not what this is. The real concern I would have, though, is for this to occur, there has to be something pro-inflammatory or nutritionally deficient in the mom. The mom has to be suffering from some kind of nutritional deficiency or some kind of chronic inflammation. And that would be my big concern here. The only thing you do for the baby is going to be this FETO procedure, depending on how severe it is this FETO surgical procedure. But I would be more concerned about the mom taking care of herself. And this is true for all pregnant women or women who are thinking about getting pregnant. You want to be packed, loaded, saturated, dense with good nutrition. You want to be taking 100% care to have zero tolerance for pro-inflammatory foods. And that means, of course, the usual suspects. Anything that you have food intolerances or food allergies to, processed foods, fried, cooked fats, French fries, pizza, deep fried turkeys, deep fried Snickers bars, whatever it is that we're eating that has fried fats. Anything that's pro-inflammatory is going to run you higher risks for a baby that has birth defects. So that's where I'd be going with this. The baby, dealing with a diaphragmatic issue, a hernia in utero, there's no nutrition that's going to fix that. But you should be concerned with further defects. I'm not sure how far along the baby is, how long the fetus is, but you should be concerned about further issues. And it's extremely important for the pregnant woman to understand she is under major, major, major duress. And if she's nutritionally deficient, that means the fetus is going to be nutritionally deficient, and that implies birth defects. Doc is freaks people out sometimes when he says there's no such thing as a genetic disease. And he's right, even though obviously in utero, if you don't have the biochemical milieu that the fetus is living in is not set up correctly, there's going to be genetic defects. But those genetic defects are secondary to nutritional deficiencies and toxicity inside the body of the mother. So yes, there's no genetic diseases that are, in the sense, everything's genetic. But you can't say this is hereditary, this is just in my genes. That's what Doc means. You can correct the milieu that the genes are developing in. Genes need nutrition too, like every other part of the body. Genes need a clean environment to do their work like every other part of the body. So the way you deal with these kinds of conditions, and this mom should be very cognizant of this, because the fact that the baby or the fetus is already dealing with some kind of congenital issue means that the milieu or the environment that the fetus is growing in doesn't have what it needs. It's not conducive to healthy fetus. So mom has to be very careful about supplementation and about toxicity. That's really where I would be going with this. As far as the hernia goes, that's not really a nutritional issue. That's going to have to be addressed surgically.
Okay, quick question about that. Is this diaphragmatic hernia, if it weren't corrected by surgery in utero, is this something on its own besides the
No, it's not going to heal itself.
Is this something that's going to be problematic for this
child? Yes, it could be problematic later on.
Problematic as in life-shortening?
Anything can happen, yes. It could involve the organs. It could involve the health of the organs, for organs to develop. The fetus is not developing properly.
Okay. Gotcha.
So it's not like the congenital hernia itself is going to lead to other things, but the same problem that's causing the congenital hernia could be causing other organs to not develop as well as they should.
You're the man. Deborah Smith has a question. How could a person reverse symptoms of long-term oxycodone uses?
Okay.
And they've had 10 surgeries. They're feeling very lethargic and confused.
Yeah.
And complete brain fog.
Yes. First of all, there's going to have to be a lot of willpower that's involved, because when the body goes off of pain pills, you can think of pain pills like a mouse trap, pushing down the spring on the mouse trap. So the body has pain, that's just a symptom. The body wants you to feel pain. We may not like the pain, but the pain is telling us something. So what we're doing is we're pushing the spring down on the mouse trap, right? That's what the oxycodone and the pain pills are doing. They're pushing the spring down the mouse trap. As soon as you remove the oxycodone, boom, the mouse trap's going to spring, or the spring is going to jump. That's what causes the tremendous withdrawal symptoms that nobody wants to go through. When you go through withdrawal from oxycodone, your body goes through a massive emergency from a biochemical perspective. You shake, your pulse goes high, your breathing is really fast. You can't have tremendous anxiety. Your blood pressure goes up. You have diarrhea and loose stools. All of the things that have been suppressed, you're now going to feel, and nobody wants to go through that. This is why withdrawal is so hard. So if you want to try to do it yourself, you want to wean yourself off. You don't want to go cold turkey. Going cold turkey can create a serious problem, like a life-threatening problem, depending on how severe your addiction is. And you want to do relaxation strategies while you're withdrawing. You want to be relaxing the body as much as possible to counteract this hyper-sympathetic or hyper-stress response, hyper-emergency response. The body thinks there's an emergency, a major emergency, as soon as you withdraw. This is why people can't withdraw, because their body goes through this massive emergency response. So calming the body down is very, very important. Nutritionally speaking, there are pain-relieving and anti-inflammatory nutrients that could be helpful, particularly fats. Ultimate EFAs are a must-have. Endocannabinoids, like the CBD products. Youngevity has some great CBD products. Those can be helpful. Going low calorie and low sugar, keeping the body in a calm state from a metabolic perspective. Sugar spikes everything up, and it's very pro-inflammatory. If you have food issues, food intolerances, food allergies, don't eat any pro-inflammatory foods. Correct digestive health issues, if there's leaky gut health issues, anything you could do to keep inflammatory factors out of the blood. So you'd use all of the digestive support strategies. Basically, what you're going to want to do is you want to calm the body down through breathing techniques, relaxation techniques, and don't put anything in the body that amps it up, especially sugar and processed foods and excitotoxins. Keeping the body in as calm a state as possible is the strategy for dealing with withdrawal, and always withdrawing slowly, not going cold turkey, and involve your healthcare professional with your weaning off strategy or your weaning off protocol. Also, anti-inflammatory and pain-relieving nutrients, particularly essential fat, ultimate EFAs, as well as the hemp FX products, and also one supplement that we don't talk about, one Youngevity product we don't talk about a lot, is the CM cream and the CM capsules, both of which contain fats, specifically a fat called cetyl-myristoyl, which has pain-relieving and anti-inflammatory properties. Okay. And that would be my strategy for dealing with for withdrawing from opiates. Okay,
now let me ask you: would they use the Renew IQ and the Smart to deal with the brain fog and those type of things?
You can do that. I mean, but it's not really. You can do that. It's not going to hurt you, but that's not going to really make. It's more significant to keep the body in a calm, relaxed state and not put anything into the body that hypes up the biochemistry. Synaptive and brain health products, like you mentioned, those aren't going to hurt for sure, but that's not going to be directly involved in the weaning off process.
Okay. And then we have a 79-year-old man whose feet are swelling.
Okay.
And wants to know what
swelling. Yeah, swelling feet is a very common sign of poor circulation. When you think about the circulatory system, it's a tube, basically. Simply put, you just think of it like a tube. It's much more complicated, obviously, than that. But think of a tube. As the blood circulates, it has to have enough push in order to circulate. Once it becomes sluggish, usually due to toxicity in the blood, can also have to do with kidney problems as well as dehydration. There's a few things that can be involved, but usually it's toxicity in the blood. could have to do also with poor heart function. The fluid does not move with facility. It kind of slows down as it's moving. And as it's slowing down, leakages are more prone to occur. Those leakages from the vessels, the blood vessels, into the tissues are perceived as swelling. The swelling is a sign of fluid that's leaking through the blood vessels because the blood is not moving around, circulating appropriately. Now, if there are immune factors, that is, the immune system and the inflammatory system is activated through a leaky gut, that will exacerbate the problem. If you have, for example, histamine, which we've talked about in the past, being secreted into the bloodstream, that will cause the blood vessels to expand and increase the leakage. If you have other toxins like aldehydes or something called LPSs or any kind of toxin that gets in through a leaky gut, that will make the problem worse. So your strategy is going to improve the movement of blood and stop the flood of toxicity that gets into the bloodstream through a leaky gut. There's lots of ways to do this. Number one, healthy brain and heart pack. Number two, make sure you're hydrated, drinking lots of water to improve the movement of blood.
That sounds antithetical.
Exactly. Sometimes people think that's the opposite of what I want to do. Fluid, expanding the fluid content of the blood will improve circulation. Number three, if there's any toxicity that's getting into the bloodstream through a leaky gut, you got to deal with all the digestive stuff that we've been talking about. We've talked about now for 15 or 20 minutes. I'm not going to repeat everything. Food elimination, all the digestive support supplements that we just talked about. And then fourthly, if you have any blood sugar problems, whether or not you've been diagnosed as a diabetic, that will impact the movement of blood and kidney function. So treating yourself like a diabetic, low carb, diabetic support supplements, more fiber, calorie restriction, exercise, movement. Movement also will help support heart health, cardiovascular health. So number one, you want to make sure that you're dealing with the circulatory system, improve movement of blood. Number two, you're going to work on toxicity that's entering in through a leaky gut. And number three, you address kidney function by treating yourself like a diabetic. Healthy blood sugar pack, healthy brain and heart pack, all the digestive support supplements, and eliminate any problem, food elimination, eliminating problem foods. Go ahead. I'm sorry, AJ.
What about when we hear about edema sometimes when we hear about swelling, they mention congestive heart failure.
Yes.
Are the B's involved here?
Absolutely. That's the healthy brain and heart pack. Absolutely. 100%. Yeah. Your B vitamins are important for all the energy processes. B vitamins are involved in how the body turns food into energy. So anything that involves energy, whether it's just flat out fatigue, whether it's a poor functioning systems that require energy, a lot of energy, like the heart and the brain and the immune system functioning less than optimally, always look at energy nutrients. The B vitamins are your energy nutrients. So yes, for all cardiovascular health issues, the B vitamins are extremely important. In fact, the B vitamins are probably more important than anything you do to deal with cholesterol, working with the B vitamins because of homocysteine as well as full-blown cardiovascular function. Also, there are nutrients which are in the healthy brain and heart pack that have specific roles to play in heart health, including magnesium, vitamin E, and coenzyme Q10, all of which you'll find in the healthy brain and heart pack.
All righty. Well, Pharmacist Ben, you're doing really good on time today. This is pretty. Yeah, okay. This is pretty good. I mean, I still have more questions than we're going to be able to get to. Okay. However,
we can do. We got 14 minutes or 12 minutes.
I'm pretty impressed with you today.
Thank you.
So Deborah.
I live to impress. That's why I'm here.
That's right.
I'm here to impress. So
that's right.
I'm glad. I'm doing a good job.
Okay, so we're gonna go to this one. Julie called in earlier today and mentioned that she had seven compressed vertebrae, and they have been proved in this year that she's been dealing with the longevity products, but she's wondering what she can do to kind of help accelerate the repair of these compressed vertebrae.
Healthy bone and joint pack. Treat yourself like a diabetic. And I would be taking glycation, which is the reaction that sugar has with tissue, can accelerate the breakdown of connective tissue and collagen, which can totally jack up the vertebrae as well as connective tissue in the skin or connective tissue in the bone or anywhere where you have connective tissue in the blood vessels. So healthy bone and joint pack. Bone soup, by the way, is great for dealing with these kinds of issues. Making sure you're using bone soup. You might want to consider the Hemp FX just for the pain. The CM cream and the CM capsules also for the pain. Those can be helpful. And then if there are any causative factors, specifically, in addition to blood sugar, digestive issues, and remember, leakage of histamine, mast cell activation syndrome, dysfunction of the bile system, all of these can exacerbate inflammatory conditions. We spent a lot of time, I think last Friday, talking about bile and its relationship to fats and fat processing. There are fats, little tiny fatty molecules, that are associated with inflammation and inflammatory pain. And so working with the fat system, fat processing system is also important. That's where Dr. Arias's liver cleanse comes in. That's where all the digestive support strategies that we talked about come in, including the nightly essence and the daily digest, the ultimate microbiome, and the I-26, especially if this patient knows that she has digestive issues, which sometimes we know, sometimes we don't know. But if you know you have digestive issues, that gives you a nice marker that you can work with.
Okay, Ben, Sherry, our teammate Sherry brought in a question, thank you, about a woman who's 65 and has MRSA after undergoing back surgery.
Okay.
What can she do?
Yeah, that's a bacterial infection. That's not really a nutritional issue. However, that being said, you can support the immune system and help the body handle MRSA or handle the bacteria. MRSA is methicillin-resistant Staph aureus, MRSA, MRSA. It's a bacteria that's resistant to penicillin. And this is a big problem, bacterial resistance. I remember in the 1980s in pharmacy school, we learned about how bacterial resistance is going to be a problem in 40, 50 years, and we're now experiencing that. And it is a serious problem because there's MRSA, you can't use regular antibiotics. You got to use super heavy duty antibiotics, which is what they usually do. And that will completely whack out your digestive, your microbiome, your digestive bacteria, your intestinal bacteria. So you want to use all the intestinal support strategies, particularly the nightly essence, laying off foods that have a negative effect or a suppressant effect on good bacteria, processed foods, chlorinated water, that kind of thing. FODMAPs foods, which can throw off bacterial population. Treat yourself like you have a digestive health issue and reduce the load on the immune system. Reduce the load on the natural immune systems, on the immune system's natural work so that it can deal with the excess bacteria from the MRSA. Now, there are also nutrients that can support the immune system. Vitamin C, of course, is the king of immune nutrients. You get that in the Beyond Tangy Tangerine. The ultimate selenium has immune boosting properties. The B complex can also help with immunity. I love an amino acid derivative called NAC, which you've heard of. I forgot which one of our we have a couple products that have NAC, but you may want to consider super high doses of NAC. And then just do everything you could do to keep the body's nutritional and immune resources dedicated towards the MRSA and not towards processing foods and other toxins that are getting into the bloodstream. Conserve your nutritional resources in addition to using nutritional support for the immune system, as well as nutritional support for the digestive system and food elimination strategies. Okay.
I'm not sure, but I think this reverse product has NAC in it.
There was one, yeah, it's the one with resveratrol. It's called, is it the de-stress? No, it's not called the de-stress. Maybe Becca knows. Maybe she can chime in.
it's RYL beta 500 has the resveratrol.
No, there was one that has NAC in addition to resveratrol. I forgot which one it is, but we can. It might be the cell. Yeah, it might be the Cell Shield actually.
Thanks, Sherry. Okay. I did have one question about what you were saying. You know, sometimes when you speak about antibiotics, Doc kind of refers to, and I've heard you differ on this. Doc refers to colloidal silver as one that kills all bacteria.
Yeah.
Is that accurate, or what?
Well, yeah. It's not a strong antiseptic. It will kill bacteria, but it's not like super strong. I use a lot of colloidal silver in my skincare business, and it's not an incredibly powerful antibiotic, but you don't really want incredibly powerful antibiotics because you have good bacteria. What's neat about colloidal silver is it kills the bad guys, but not the good guys. So that is the advantage to using colloidal silver. And that might be something she wants to try for MRSA, but MRSA is by definition super
resistant.
Powerful. Yeah, it's so resistant. So it's not like you're going to cure MRSA with colloidal silver, but it wouldn't hurt.
Okay. So my leader, Becca Dukes, who's out on YouTube, brought in a question from Facebook. Can you ask what helps get rid of eye floaters like clouds, not the black dots?
Yeah.
And the woman says that she's going on 2 years of having this.
Yeah.
Ophthalmologist.
You don't get rid of eye floaters any more than you get rid of cracks in your windshield on your car. It's just like saying, oh, I got cracks in my windshield. How do I get rid of them? How would you get rid of cracks in the windshield of your car, AJ? What would you do?
Replace
How'd
the
you get
windshield.
rid of them? You have to replace the windshield. You can't get rid of cracks. What you're experiencing as eye floaters is deterioration of what's called the vitreous humor in the center of the eye. The eyeball is made up of a jelly-like substance. The ball itself, the eyeball itself, is a jelly-like substance, and this jelly-like substance changes shape as we get older, and clumps of various connective tissue fibers. You actually have, that jelly-like substance is actually connective tissue, and clumps of collagen start to form. The collagen deteriorates, and you get little clumps of collagen inside the eyes. The vitreous humor is actually breaking down. So what you want to do is you want to use your collagen building strategies to deal with the floaters. You can also, by the way, get these floaters if you have trauma or injury to the connective tissue inside the eye. But usually for most people, it's associated with aging and it's associated with general deterioration. So what you want to do is you want to treat it as a sign of general deterioration of the connective tissue. That means the connective tissue in the bone is deteriorating, the connective tissue in the blood vessels is deteriorating, the connective tissue in the intestine is deteriorating, the connective tissue in the skin is deteriorating, as well as the connective tissue inside the eyes. And by the way, your healthy bone and joint pack, which is contains connective tissue building supplements, is going to be good for preventing floaters. And that's really what you want to do, is you want to prevent floaters, not necessarily. It's very difficult to treat them. There's no real treatment for dealing with these with this deterioration. Now, if you don't have any major damage like a hemorrhage or something like that, basically you want to make sure that you check the condition so it doesn't deteriorate, it doesn't get worse and start to affect the retina. That's really what you want to do, is you want to slow down the progress of the floaters. And the way you do that is, number one, with nutrients that help build connective tissue, keeping in mind that vitreous humor is part of the connective tissue, and then eliminating anything that exacerbates or accelerates connective tissue deterioration, which means toxicity from foods, as well as sugar. Now, the good news is if you do all of this stuff, these floaters, they're technically they call vitreous floaters, or I forgot the technical name, but vitreal deterioration can sometimes get better with these kinds of strategies. As far as completely eliminating them, I don't know that you're going to completely eliminate them with a nutritional protocol, but you can slow down the progress with a nutritional protocol.
And
it is something you want to. It is something you want to go to an ophthalmologist for, because you don't want a permanent vision loss, or you don't want You don't want retinal damage. It is definitely something that you want to look. You want to go to a ophthalmologist for, and you want to make sure that you don't have any detachment issues. The detachment is really where you're going to run into a big problem.
Some of our health coaches are on Rumble because we're not in Zoom like we will be tomorrow.
Yes.
And one, I'm not sure who Synergy Mom is, but she said Reverse has NAC. And then Jill, you know Jill.
Yeah.
She says True to Life Daily Detox has NAC, and so does Reverse.
Okay, good. Those are all good things then.
Yeah. Well, Ben, we're at the top of the hour. I have another question, but I'm going to see you tomorrow.
We can do that tomorrow. Yeah, we can do that tomorrow.
I may be hosting tomorrow. What do you think of our Ben's Bites Daily with Doc?
Love
today?
them. I want to do more. Oh, today? That's
Yeah,
great. But I want to do more of them with you, like these little 2-minute ones.
Okay, I'm going to bring Sherry on the screen with us. Sherry helped us out today.
Hi, Sherry.
And brought in some questions. And Ben, you're the man. It's always great to see you. And we will see you tomorrow, everyone, on Daily with Doc.
Thank you, guys.
Actually, Pharmacist Fridays on Daily with Doc.
AJ, you rock. Rebecca, see you tomorrow, I hope, or not. I hope your move's going well, and thank you, everybody, for watching. Bye.
Thank you.